Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Linsman, and my guest on the podcast today is Erin Muck. Erin is the president and CEO of CCMH, and we have kind of a tough conversation to have today, Erin, and it has everything to do with the end of OB services here at CCMH.
Yep, unfortunately, yes. So, we've actually, we always look at our service lines and we're constantly looking at how can we make them better, how can we do it the best, can we assure quality, what can we do to make sure that we're providing the best services to our community. So when we have been evaluating our OB service line for, some time now, really watching the amount of deliveries that we're having, every year. And so for the past 3 years, we had under 100 deliveries, and this last year we were under 60. And if you ever spent any time doing any research, the studies will show that the inability to maintain quality after you get under about 100 deliveries, and they're actually starting to push that up to 200 deliveries a year, is difficult to really maintain that quality, and health outcomes for maternal and fetal outcomes do go down. And so looking at it's a very difficult and hard decision, but I feel as our commitment to the community to offer quality and safe services that we really needed to look at how could we do this differently, because we cannot assure 100% quality 100% of the time when our OB deliveries go down like that. So I wouldn't say that we're not doing amazing care right now, but that'll dwindle over time, and I'm not willing to take that risk for our community members, for moms and babes.
I think that there are a couple of other extenuating circumstances here as well that we need to talk about. First of all, there is a physician shortage across the entire United States, but in Crawford County in particular, we've been in a medically underserved area when it comes to physicians for a long time. The other part of it, even notwithstanding the physician shortage, is the fact that coming out of medical school today, most of the new physicians, most of our new doctors, who would be doing this kind of work don't do OB. They leave it, it's become a much more highly specialized area. And that's part of the reason why this has become a little bit more difficult, not just for us, but for a lot of other small hospitals across the state.
Yeah, I think even due to litigation purposes that we saw, I want to say about 3 years ago, that out of one residency program in the state of Iowa, none of the OB/GYN residents stayed and got jobs in Iowa. They all left. Now, I'm very appreciative to our representatives and really doing things regarding tort reform, which I think will be helpful over time, but really recruiting to the rural areas is more and more difficult. And when you're specializing like that, it's even significantly harder to recruit OB/GYNs and family medicine with OB. And just as you said, Don, they really specialize in medical school now. And so finding one that really wants to come to the rural areas is extremely difficult. We've been recruiting for 2 years for a position here, and we have not found anybody that wants to come to rural Denison to do that. So.
I think the other thing, and you alluded to it earlier, Erin, is that the birth rate across the United States, but especially in rural areas because there are too many old guys like me, for lack of a better way to put it, our population in rural Iowa is aging pretty rapidly.
Yes.
And I think that's the other part of what's going on here, is that demographically we're seeing a lot of changes in terms of our population, which also leads to a fewer number of births.
Correct. We've seen that over time, but I really do think the pandemic escalated that, and that the national birth rate is going down significantly. And so in Crawford County back in 2020, we did 120 deliveries, and which was about 65% of the market share, which is a good market share for OB services. There are people that obviously want to go to the city, but there's also people that need to go to the city because they're high risk. And so that, when you think about that that's only 120 deliveries, and knowing that the delivery rate is continuing to go down in the United States, it's not surprising watching our numbers go down. It's not, but it just gets to the point where how can you make sure that you're assuring the best quality for our residents.
You're listening to the Here's to Your Health podcast. I'm Don Lentzman, your host, and my guest on the podcast today is Erin Muck, President and CEO of Crawford County Memorial Hospital. The opposite side of the OB conversation then is the GYN conversation, because those two things to a certain extent are linked, but in many instances they're separate, because the gynecological activities or the surgeries that take place are not necessarily always connected with OB. So when it comes to gynecology, how are we going to deal with that going forward?
Right. So as you know, we do have an OBGYN, which is Dr. Eric Simons, and he, starting August 1st, will wind down into being a PRN part-time employee, so as needed, and so he can go off and explore other adventures. But we are looking for some GYN visiting specialists to be able to offer GYN services in our community. So we're well on our way with that. But just know that part of even the OB piece of it is family planning, birth control, all of those things. And so all of our family medicine providers, nurse practitioners, PAs, family medicine docs, they all will still be able to offer those services. Nothing with that has changed at all. And so I highly recommend still having those conversations with your primary care physician on what's the best family planning for you and birth control and all of those other matters. And they will assist you with that. We still offer multitude of variety. And then also, one of the concerns may be tubal ligations, and we still offer them here at CCMH, and Dr. Wright and Dr. Simon still can perform them, and so that is still a service we'll continue to offer here.
So one last opportunity to wrap that conversation up, because I know that August 1st is the date when OB will be ending. Anything else you'd like to add to that conversation before we move on to our next topic today?
Well, I think some people worry a little bit about, one thing we wanted to be able to offer to our community is prenatal and postnatal visits in the community if possible. We're very grateful for St. Anthony's for stepping up and saying that they'd be willing to do that in town, which is great, and then offering prenatal classes here at CCMH, which is great. But I would also say that some people will be worried that can they make it to wherever they're going to deliver? What if there's an emergency? Are we trained? Obviously, we still have staff that's trained in OB here, but as of today, we actually have the University of Iowa here, and we are training all of our ER staff, our ER physicians, all of our charge nurses, and current OB staff on OB emergencies in the emergency department and in the ambulance. And so everybody's going through that training right now. We've also just set up on Friday, we will be having training for our volunteer ambulance squad. So the Ambulance Association here in our community will also be having training on OB emergencies and deliveries and newborn care. And so I feel that we have taken the most appropriate steps and to assure that we are going to provide safe care when we need to, and then also that we're getting patients where they need to go for deliveries with to promote the best outcomes.
And one last note, perhaps, that I'll add to what you just talked about. Mm-hmm. The tax dollars that CCMH does take in mostly goes to support our emergency room, and so that particular exercise that we're in right now, that training that we're doing, will help us to address the OB issues that we have. But we don't use tax dollars for patient care. We don't use tax dollars except for a few purposes, including, as I said, ER, property insurance, malpractice insurance, and some employee benefits. So maybe one thing for people to keep in mind is that the services that we offer, going back to the very beginning of our conversation, have to do with a constant evaluation of what's best for our patients.
Right. And I think I don't want anybody to think that this is a financial decision, because if it was, OB services would have stopped years and years and years ago. It is not a moneymaker by any means. It is definitely something that we wanted and want to continue to provide for our community. But if, as I said before, if you can't guarantee quality 100%, you really shouldn't be doing it. We can't be everything to everybody. That would be like saying we're going to offer open heart surgeries here. It's not appropriate. I mean, that's a probably pretty extreme example, but I really think it's all about safety and quality, and we want to assure that everything that we offer here is the best for our community and will have the best outcomes.
Well, I wanted to expand our conversation today, but I think I'm going to leave it there because we have other things that we want to talk about. I know we want to come back and talk a little bit about the new electronic medical record that we have and how that implementation is going, and we have our building construction and remodeling project that's going to be coming up soon. We want to talk about that as well, but we're going to leave those for another day. And in the meantime, I'm just going to say thank you so much for your conversation today. People who have questions about OB, what would you like them to do?
They're more than happy. I'm more than happy to field any questions that they have. They can reach out here, call the hospital, ask for my assistant, and I'll be happy to talk to anybody that has questions about OB. I know this is a very personal and it's just a very personal topic, and I get it. It's very difficult. I'm an OB nurse, and I swore I would never ever let that go here. And unfortunately, hard decisions have to be made to make sure that we are always providing safe care. So it's terrible. This is one of the hardest things that I've ever had to do.
Well, Erin, I appreciate your candor and your time today. Thank you very much.
You're welcome. You have a great day.
You too. My guest on the podcast today has been Erin Muck. Erin is the president and CEO of Crawford County Memorial Hospital. We've been talking about the discontinuation of OB services beginning August 1st. For those who have questions, the number to call 712-265-2500. I'm Don Lintzman, your host for the Here's to Your Health podcast. Have a great day.